Welcome all for the today's class. Today we continue with our clinical governance module, and today's topic is Mental Capacity Act 2005. This topic is going to be very important from the examination, and you expect either EMQ or SBA from mainly EMQs from this particular topic. So listen to this particular talk very carefully. So in this article, what you are supposed to know, we will discuss the core principles of Mental Capacity Act. Okay, so there are core principles which one should understand. There are six things basically we have to understand. One, there is a presumption of capacity. So for every adult, once we say that the person is more than 80, we have to assume that there is a capacity. Okay, there is a mental capacity to think, to make the decision, unless proved otherwise. Okay, so unless proved otherwise, we have to presume that there is a capacity and the person can make the decision. Okay, so assume capacity unless proved otherwise. This is the default position. That is point number one. Second point is always support the decision making. So for some reason, if the mental capacity is not there, or it is not up to the mark, or it is compromised, then take all steps to help the patient to decide. You can use interpreters, you can use aids, because there may be some obstacle in making the decision. Okay, it may not be a complete lack of capacity, but it may be compromised for some reason, maybe language barrier or whatever it is. So second principle is that always support the decision making. Third, unwise decisions are allowed. Okay, so if there is an adult, if there is a capacity, then unwise decisions are allowed. So if the person is making unwise decision, it doesn't mean that there is a lack of capacity. Okay, so generally they can ask you the question on this particular theme, that the lady is pregnant and there is a CTG is non-reactive, it is an uninducible cervix, and she requires emergency cesarean section. However, she refuses because in from the antenatal period, if she has decided her plan of action that she wants to go ahead with a natural birth and she wants to stick to that decision, even if there is a threat to the baby's life, she has made a wise decision. Wise decision means unwise decision, but she has given a thought. When you have explained everything, what are the consequences, she has weighed the pros and cons and made her decision, then unwise decision is allowed. Okay, so this is the next thing which we should remember. Second, when there is a no mental capacity, or the mental capacity is compromised, then we have to act in the best interest. Okay, so here again, this particular theme, generally they can ask you the question. Okay, so best interest concept we should understand. So decision must be should be beneficial to the patient. So this has to be there when doctors are making the decision on behalf of the patient. The decision must be beneficial to the patient, and it applies if there is no capacity. So if the person does not have capacity, in that particular case, doctor will have to act in the best interest, and the decision must be beneficial to the patient. Second is a least restrictive option. Okay, so choose option that least restriction. So when we are making the decision, we have to see to it that whatever the decision, sometimes the option which are available, both options may not be absolutely good for the patient. They may have some harm. Then whichever has got a least harm, that will be selected, because we are making the decision in the best interest of the patient. Okay, if there is no other option and both options have some what you can say ill effects, then whichever is the least restrictive the option, that will be selected. So it has got an ethical and legal basis. And next is autonomy. So patient has got a right to accept or refuse the treatment, even if the treatment is life threatening. So person with good mental capacity has got a right to accept or refuse the treatment, even if there is a life-threatening issue. Okay, so these are the six core principles which we have learned. One, for adult, always there is a presumption of capacity. Second, we have to support the decision making wherever there are some barriers. Third, unwise decisions are allowed for the person who has got a mental capacity, provided the prerequisites like whole information is given, all the criteria are fulfilled, then unwise decisions are allowed. Next, when there is no capacity, act in the best interest of the patient. When we are acting in the best interest of the patient, least restrictive option is to be selected. And autonomy gives the right to the patient to accept or refuse the treatment, even if it is a life threatening, even if there is a issue with the life. Okay, that is what is. So on this, we have a couple of questions, doctor. Can you please read these questions?
A 32-year-old woman refuses induction of labor despite counseling regarding increased risk of stillbirth. She understands risk, benefits, alternative, and consequences. The obstetric team feels her decision is unreasonable. What is the most appropriate principle? A. Unwise decision means lack of capacity. Court order should be sought. Adults are presumed to have capacity unless proven otherwise. Family should decide. Treatment should be proceed in fetal interest. So it is C. Adults are presumed to have capacity unless proved otherwise.
Okay, so we have concept is clear here. Adults are presumed to have capacity unless proven otherwise. So capacity is presumed here by default, and she has understood what exactly the consequences. Then she has made her a wise decision. Okay, next.
A 40-year-old woman with limited English requires consent for emergency cesarean section. She appears confused during counseling. What is the most appropriate next step? Assume she lacks capacity, ask husband to translate, proceed without explanation, take all practical steps in support decision making, and last, obtain consent from relatives. So it is proceed without explanation. So what can it be? It is an emergency cesarean, so take all practical steps to support decision making. D.
Yes, see, listen, read. She has got a limited English knowledge. Okay, women with
Yes.
limited English knowledge. So some limitation is there. Can that be overcome? Okay, so it requires a
Mm,
consent for an emergency cesarean section. Okay, unless it is a
mm,
cord prolapse where even the verbal consent is required. But otherwise, emergency cesarean section may be category 2, category 3 cesarean section. Okay, category 2 cesarean section, I mean to say. Okay, so in that particular case, definitely you have a time. Okay, so she appears confused during the counseling. So this can be overcome. So how we can overcome? Take all practicable steps to support
support
decision making.
decision making. D is the
Okay.
answer. Yes.
Yeah.
Yes.
So use interpreters, visual aids, simplified language, or communication support before concluding lack of capacity. And for interpreters, no family members. Okay. Always remember,
So,
professional interpreters
so
only.
professional interpreter will come and support decision making.
Yeah. Next, doctor.
A competent pregnant woman refuses blood transfusion despite life threatening postpartum hemorrhage risk. She clearly understands the consequences. What is the most appropriate principle? A. Refusal feels lack of capacity. Doctors may ignore refusal. Capacity is lost during obstetric emergency. An unwise decision done not indicate lack of capacity, family consent overrides. So it is C, capacity is lost during obstetric emergency.
Is it?
Hmm? Doctor may ignore refusal if risk of death exists.
No. An unwise decision alone does not indicate lack of. What is the principle here? She is competent pregnant woman. She is
Hmm.
refusing the blood transfusion despite of life-threatening PPH risk. There is a PPH risk. Okay. There is no altered sensorium or something like that. You got it.
So
There is a
D means an unwise decision alone does
alone
not
does not
indicate
indicate.
lack of capacity. So
You
D
got
is the
it.
answer. Yes,
Yeah.
sir.
Yeah. Yeah. Only additional thing is that here all pros cons information has been provided. Okay, but that includes the competent woman. That means she has understood the things. Okay, so
Hmm.
unwise decision alone does not indicate lack of capacity. Okay, unwise
Yes.
is not equal to the lack of capacity. When such
Hmm.
decisions will be there, we will require more counseling, that's all. but we cannot have the paternalistic attitude. Okay, our responsibility is to provide the information. Next, doctor.
A woman with severe learning disability lacks capacity to consent for treatment of pyometra. Surgery is recommended to prevent sepsis. What is the most appropriate principle guiding? So here the she has a learning disability and she is lacking capacity to
Yes.
consent for the treatment. Surgery is recommended to prevent sepsis. So the option is family decision automatically overrides medical opinion. Treatment decision should be based on best interest. Surgery cannot occur without patient consent. Doctor should avoid treatment if capacity absent. Relative should sign consent. If a B treatment decision should be based on best interest of the patient.
Yes, here there is no capacity. The doctor has to act in the best interest of the patient.
The
Okay,
patient.
so
Hmm.
treatment decision should be based on the best interest. Best interest apply when patient lacks the capacity.
Yes.
Next question.
A woman lacking capacity requires management of agitation on the postnatal ward. Which principle should guide treatment planning? A. Use maximum restriction to ensure compliance. Sedate all non cooperative patients. C. Choose the least restrictive effective option. Restrain patient routinely. Prioritize staff convenience. So it is uh, C. Choose the least restrictive effective option.
So always choose the least effective option when we are making the decision on
Hmm.
behalf of the patient or in the best interest of the patient. We have to keep this particular thing in mind. Least restrictive, least effective option is will be selected. Okay, so select interventions that interfere least with the freedom and autonomy. Next.
So, in patients who lack mental capacity and the doctor has to take interest, he should take the decision with least restrictive option and with
Yeah,
the best interest.
so the patient. Okay, yeah.
Yes.
Next.
A competent woman with severe preeclampsia refuses recommended cesarean section despite understanding the maternal and fetal risk.
It's a
What is the
repeated
most
IPs. Yeah.
what is the most appropriate management principle? A. Fetal interest override maternal autonomy. Court approval is always required. Competent adult may refuse treatment even if life threatening. Husband should make final decision. Treatment should proceed with the guardian at refusal. So a C is the answer. Competent adults may refuse treatment even if life threatening. So this is
Yes. Yes.
autonomy. Yes.
Yeah. Okay. So
Yes.
competent adult may refuse treatment even if it is a life-threatening. So respect for autonomy includes the right to refuse the treatment. So what we
Yes.
have understood up till now, one is a mental capacity is always presumed unless proved otherwise. And the
Hmm.
patient, because of this mental capacity, patient has got an absolute right to accept or refuse the treatment. Second, there is a concept of advanced decision. Okay, now
Hmm.
in advanced decision, the
Hmm.
person can make the decision for future refusal of the treatment. Remember, when there is an advanced decision, it is for the refusal of the treatment. Okay, another thing is that there is a lasting power of attorney. So this is
Yes.
another concept. Okay, lasting power of attorney is the proxy decision maker when the capacity is lost. Okay,
Hmm.
so what happens now? The person has got the capacity, but it is not sure what will happen in the future. So
Hmm.
for that purpose, one, the person can make an advanced decision. That is
Hmm.
one thing. Second,
Yes.
there can be lasting power of attorney. Okay,
Yes.
this is
Hmm.
another option. And if both the things are not there, then you have the best
Doctor.
interest basis of the decision if there is no capacity. You got it? So always there is a
Yes.
capacity unless proved otherwise. Okay, now the patient also who has got a capacity now can make an advanced decision for refusing the treatment. Remember, it is only for the refusal of the treatment, not for asking the treatment. It is only for the refusal of the treatment. Future refusal of the treatment, patient can make a advanced decision. Okay. Second, what he can do, patient can appoint a lasting power of attorney. Okay, that is a proxy decision maker when capacity is lost. Okay, and that will be made when there is a capacity present. For the future it will be made. Second, the last is the best interest that we have already seen. Okay, so there are tests for the mental capacity. It's actually a two-stage test. Okay, first thing we have to check in the first stage whether there is impairment or disturbance in the function of the brain or the mind. That means
Hmm.
whether there is a cognition of the
Cognitive.
brain is affected or not, understanding of the person is affected or not. Okay,
Hmm.
so stage one, is there an impairment of the disturbance in the mind or the brain? So it
Hmm.
may be temporary, it may be permanent. That is the
Yes.
first stage to identify the disturbance. Second stage is, does it impair the decision making? Okay,
Hmm.
so there may be some limitation, but that limitation may not be hampering the decision making. Okay,
Hmm.
so it is a decision specific.
Hmm.
I hope you are getting, there may be some kind of learning disability, but it doesn't mean that he or she cannot make the decision.
Yes,
Okay.
sir.
And again, this is a context specific. The person may be able to understand simple things like examination, clinical examination related things, but may not be able to understand the operative related things which are complex in nature. You got it? So
Yes.
the person may be able to give the consent for simple things which he or she is able to understand as
Understand.
per the mental capacity. Okay. So first stage is the impairment or disturbance in the brain, that checking, that is the temporary, it may be temporary or permanent. Second stage is, does it impair the decision making, which is a decision specific. Okay, so these
Yes.
are the two stage mental capacity test. Then there is a functional test, how we will identify that there is an impairment or not. So this here it is a URWC. Okay, whether the
Yes.
person is able to understand, then retain the information, weigh the information, that means the pros and cons, and whether the person can communicate it. Okay,
Yes.
so these this is the functional test. Okay, so URWC, whether the person is able to understand, retain the information, weigh the information, and communicate the decision. So
Hmm.
understand the nature of the decision or the nature of the intervention, retain, even short term retention is acceptable, whether the person is able to weigh the pros and cons, and whether the person is able to communicate in any method. Okay, so just remember this URWC: understand, retain, weigh, and communicate. So
So,
next
sir,
is a,
that way can be analysis also, no? He's
yes,
analyzing and
yes,
then,
yes, yeah, analysis also.
yes.
Next important concept is a capacity characteristic. When we talk about the capacity is present, we should know what exactly the capacity characteristics are. The capacity is dynamic. Okay, it fluctuates. For example, person with full capacity in labor, or when she is given some kind of analgesia, or
Hmm.
has taken some intoxicating drug, the person under that influence, the capacity may not be there. You got it?
Yes.
So
Yes.
the capacity is a dynamic, it fluctuates, that we should remember. Then it is a decision specific, may vary with the complexity. Okay, so
Yes.
depending upon the complexity of the intervention which is involved, so decision specific capacity will be there. Okay, then presumed continuous, once there is a capacity, we'll presume it is continuous unless and until it is proven otherwise. Okay,
Hmm. Yeah.
now coming to the obstetric situation, that is the capacity in labor. So in severe pain or when the opioids are given, the patient may lack the capacity, that we
Yes.
have to keep in mind. So counseling should be done in between the uterine contractions. Okay,
Contraction.
epidural, patient is pain free, patient has got a full capacity. Okay,
Hmm.
and it's always better to have the antenatal planning. It is recommended that the birth plan, the possible birth options, including the operative or the assisted vaginal birth, either vacuum or forceps, everything should be discussed so that patient has got idea about it.
Capacity.
Okay, then husband and partner, what is the role? Cannot give the consent. Okay,
Hmm.
opinion can be considered, but they cannot give the consent on behalf of the patient. Okay, so this option will not be selected in the examination. Now
Okay.
unwise decisions, we have already seen, unwise decision does not mean that there is no capacity. It is protected by the law. Okay, because the principle of autonomy is there. Okay,
Hmm.
so example is the refusal of blood, like Jehovah's Witness. Okay,
Yes. Hmm.
so when we are taking the decision for the best interest of the patient, what are the things which we need to look into it? It doesn't mean we have to just see the medical part and take the decision. We have to see the wishes of the patient, it may be related to the past history or the present situation, and we have to understand the wishes of the patient. Second, beliefs and values. Okay, maybe cultural beliefs, religious beliefs, they are need to be taken into account. Then clinical benefit, risk versus benefit. So this is not the only component we have to take into account, the clinical benefit, but we have to see the wishes of the patient, beliefs, values. Okay, then participation, encourage involvement. If there is a compromise capacity, try to involve the patient in the decision making, and understand the recovery potential. So sometimes it is possible that there will be recovery, so tide over that particular situation, giving the best treatment for that particular duration, you tide over that particular situation, which is a temporary incapacity for that particular patient. Okay, so these are the points which we need to take into account when we are making the best decision in the best interest of the patient. So wishes of the patient, beliefs, values, clinical benefit, participation, and recovery potential, that we need to take into consideration. Okay, so key rule is that no intention to cause the death. So in this case, when we are making the decision, there should not be any decision to cause the death. We must consider all circumstances and must consult the relevant people. So for this, what we have to do, we need to talk to the family, then family will give some insight, carers day-to-day understanding of the things will be there. Then if there is a lasting power of attorney holder, which who has got a legal authority, that also needs to be involved. And if there is a conflict, then or there are no relatives, then there are independent advocates are there regarding the mental capacity, that we need to seek. Okay, so family has got a only advisory role, and they are not the decision makers. Okay, now coming to the legal protection is there for the best interest. So we should act in the best interest. It is protected from the liability, wrong decisions, but if it is reasonable, then also it is protected, and use of restraint is allowed, but it should be proportionate. Okay, so these are the things which we should remember, that there is a legal protection even if the wrong decision happens, but if there is a justification or the reasoning, then also it is protected. Okay, now next is a advanced decision. Okay, advanced decisions are done by the patient when the patient has got the capacity, and they are meant for refusal of the treatment in the future. Now, what are the basic features? Who can do this advanced decision? The one who is major, that is more than or equal to 18 years, and purpose is refusal of the future treatment. Validity is same as current refusal. Okay, limitation, the person cannot demand the treatment. Okay, but person can refuse the treatment in future. Okay, and at that time, even if the patient does not have the capacity, it holds true. Okay, then life sustaining treatment. Okay, so patient is making the decision, advanced decision, and it is related to life sustaining treatment, refusal of life sustaining treatment. What is to be done? Then in that case, it has to be written, it should be signed by the patient along with the witness, and there should be specific statement that even if life is at risk, life sustaining treatment he or she wants to refuse. Okay, so life sustaining treatment refusal should be in writing, it should be signed by the patient in presence of the witness, and it should be specific statement that even if there is a life is at risk, but the patient can refuse the life sustaining treatment. However, patient cannot refuse basic care, that is the hygiene, warmth, oral food, water, comfort care such as analgesia. Okay, these are the things the patient cannot refuse, or illegal acts like euthanasia. Okay, then validity checklist for this, the patient should be more than 18 years, should have the capacity. Now the patient is lacking the capacity, and it should not be withdrawn. Okay, that means the patient has taken the advanced decision, but it should not be withdrawn. Okay, it applies to the current situation and meets the legal formalities. Okay, so this is the checklist for the advanced decision. Okay, so advanced decision and pregnancy is little controversial. There is no clear law as such. One has to deal with the case by case basis, and fetal interest may be considered. However, there is no as such clarity on it. Then second is a lasting power of attorney. Okay, now lasting power of attorney is the thing. It is the legal right which is given by the patient when he holds the capacity to make the decision by some third person when the person will lose the capacity. Okay, so who will appoint? The patient, who is called as donor. Okay, so he is donating the rights of making the decision. Then who acts? Donee acts. So the one who makes the decision is called as donee. Okay, then scope is, it is for the welfare as well as finances, and it will be activated when there will be loss of capacity. Okay, so that is the lasting power of attorney. Okay, then what are the limitation? This person with LPA must act in the best interest. Okay, so the person cannot act independently. Then life sustaining treatment only if the explicitly authorized. So regarding the life sustaining treatment, there should be specific authority by the donor with respect to that. Okay, cannot aim to cause the death. So anything which will lead to the death cannot be mentioned, and court involvement, if there are any dispute, there will be court involvement. Okay, now advanced decision and lasting power of attorney. What are the differences? Suppose the patient has made an advanced decision first, and then the patient has made a lasting power of attorney. Okay, then LPA created after advanced decision, in that particular case, LPA will override, even if they are contradictory to each other. You got it? So
No, sir.
if the patient has made an advanced decision, and after that the patient has appointed LPA,
Hmm.
okay, then
Yes.
the LPA will be followed. You got
O-
it?
Okay.
So
Because the patient has now lost the capacity, so now
no,
LPS.
yeah, no, once they have made the LPA, the previous advanced decision will lose.
Okay.
You got it? Patient has
Uh,
given the advanced decision. After
hmm.
that, the patient has made an LPA. Then
Yes.
whatever we will follow as per the latest one, whatever will be the LPA, that we are going to follow. So LPA will override. You got
Okay.
it?
Yes, sir.
So, what is the role of the family? As such, there is no legal role. It is only advisory role the family has got, and the importance is it helps to determine the wishes of the patient. So, when we are taking the decision in the best interest, we should look into it. We should talk to the family members. We may talk to the GP also to know the background and all. So, that is what is required. So, practical clinical application: when patient lacks the capacity, act in the best interest, consult family or the lasting power of attorney person, document clearly and seek the legal advice if there is a conflict. Sometimes there can be conflict also. Okay, so when we fail to respect the capacity, so what does it amount? What does it amount to? Okay, from legal point of view, it is a battery or assault, and from professional point of view, it is a negligence. Okay, so remember this. Sometimes they can ask you this, that which principle is violated. So what it will be called as, the when the autonomy, the principle of autonomy is violated, the legal consequences, it is considered as a battery or assault, and professionally it will be medical negligence. Okay, now coming to the valid decision making, what does it require? It requires the capacity, it should be voluntary, and there has to be the adequate information which is provided. Okay, so what we have learned up till now, the capacity is a decision specific and it is dynamic. Unwise decision does not mean that is not equal to the incapacity or there is no capacity. Then family is not the decision maker. If there is a lasting power of attorney that is more superior than the family members, advanced decision uh, is possible, and a person can refuse the treatment only with this. Best interest is the core principle. If there is no capacity, then labor pain may impair the capacity and consent refusal must be respected. So these are the things which we should remember. We have few questions on this. Can you please go through the questions, doctor?
A patient refuses blood transfusion despite risk of death. She understands consequences. Best action is A. Proceed anyway. Seek family consent. Respect refusal. Court order and sedate and translate. It is B. It is C. Respect refusal.
Yes, we will respect the refusal. Okay. So competent refusal must be respected. It is the autonomy. Next.
which is part of capacity test. One is intelligence, then education level, ability to weigh information, social status, and family opinion. So it is C, ability to weigh information.
Yes. Okay. We mention URWC. Okay. Understand, retain. Okay. Weigh the
Understand,
information
retain, and then analyze pros
and
and cons and
communicate.
then
Okay.
communicate. Yes.
So it's a part of functional test. Okay.
Functional test of the capacity. Yes.
Next.
Unwise decision indicates A. Lack of capacity, B. Mental illness, C. Legal incompetence, D. Not necessary incapacity, E. Need for detention. So, unwise decision, D. Not necessarily incapacity.
Correct. Okay.
Hmm.
Next.
Who decides best interest? Is a family, doctor, court, nurse, or patient. So, it is B. Doctor.
Yes. Not always the court. Okay. So
Yes, sir.
court will be involved when there are conflicts. Okay.
Confusion. Yes.
Next.
Which is not part of best interest. A. Patient wishes, family opinion, doctor convenience, clinical benefits, and beliefs. So it is C. Doctor's convenience.
Yes, we cannot put our convenience first. We have to see this patient wishes, family opinion. Okay.
We
Next.
have to see patient's convenience. Then advanced decision allows A. Demand treatment, refuse treatment, appointment doctor, transfer care, and legal immunity. So it is B. Refusal treatment.
Yes, with advanced decision, patient can refuse the treatment. Okay.
Yes.
Next.
Advanced decision for life-saving treatment must be A. Verbal, B. Written, C. Optional, D. Implied, and E. Witness not needed. So it should be B. Written.
Yeah, but remember in the examination, they will not give the just simple one word option. They may give written in presence of signed by the patient, then in presence of witness. So whatever is the most specific among that, sometimes more than one answer may be correct. So whatever is most specific that we need to select in the final examination. Okay. Next.
Which cannot be refused. 1. Surgery, ventilation, basic care, medication, blood transfusion. So it is C. Basic care.
Yes, basic care cannot be refused. Okay.
She can
Next.
refuse advanced treatment but not complex but
Yeah.
not the basic care.
Yeah.
LPA can always refuse life saving treatment, act only with a specific authority, override court, ignore best interest, or act anytime. So it is C, override court.
No.
No,
LPA, lasting power of attorney, how mm, can, if there is a
I can,
conflict with the LPA, then we'll go to the court. Then court
yes,
will not directly go ahead with the LPA, no. They
then
will
what
act only with specific authority. Whatever is the
do?
authority which has been given to them with respect to
Mhm.
that, they will act with that purpose only. Okay, so option is B.
Act only with a specific authority.
Authority which they have been given. Okay.
Okay. Yes, yes, yes. Understood. Family role is decision makers, legal authority, advisory, cannot override doctor, mandatory consent. So they are C advisory, they cannot make any decision.
Yes, family role is only advisory. Okay.
Hmm.
Next.
Capacity is fixed, B dynamic, C permanent, O irreversible, and A dependent. So capacity is dynamic, B is the
It's a
answer.
dynamic, but we have to assume it is a continuous. Okay, unless
Yes. If capacity is unclear, A ignore, B assume incapacity, C seek assessment, ask family, D proceed. It is C seek assessment if capacity is
capacity
unclear.
is not clear.
Hmm.
What we are going to do?
So
Assessment.
we should
We'll do the
seek
functional.
assessment, na? Seek
We'll do
assessment.
the functional test.
Yes,
Okay.
the one you
Next.
suggested. Yes.
Yeah.
A restraint is allowed if A. Routine, B. punitive, C. Proportionate and necessary, family agrees, patient requests. So it should be proportionate and necessary.
Yeah, it should be proportionate and it should be only if it is necessary, then
If it
only,
is
and it should be the
necessary.
proportionate. Okay.
So the answer should be proportionate and if necessary.
Yeah.
15. Advanced decision versus LPA. Created later. A. Advance prevails. B. LPA prevails. Both invalid. Court decides and doctor decides. So it is B. LPA prevails.
Yes. Okay. Latter LP is made. So, okay.
The letter prevails. Yes.
Yeah. So that finishes the topic of Mental Capacity Act.